Hi friends, welcome to a new session of medical exam preparations by Nurse Winners. Today we'll be seeing 10 question and answers with rationale of community health nursing or preventive and social medicine. Let's move on to the questions. First question, IUCD helps in options A. Prevent ovulation, B. Prevent sperm from reaching fallopian tubes, C. Prevent menstrual cycle, D. Prevents implantation of fertilized ovum into the uterus. The right answer is option B. Prevents sperm from reaching fallopian tubes. Rationale. There are two types of IUCDs, copper IUDs and hormonal IUDs. Copper IUD causes uterus and fallopian tubes to produce a fluid that contains white blood cells, copper ions, enzymes and prostaglandins, which is toxic to sperms. Hormonal IUDs release progestogen, which mainly works by thickening the cervical mucus, preventing sperm from reaching the fallopian tubes. Second question. Which of the following is the constituent of contraceptive pills? Options A. Prolactin, B. Follicular stimulating hormone, C. Estrogen, D. Luteinizing hormone. The right answer is option C. Estrogen. Rationale. Birth control pills contain man-made forms of two hormones called estrogen and progestin. Both hormones prevent a woman's ovary from releasing egg during her menstrual cycle. Progestins also make the mucus around a woman's cervix thick and sticky. This helps to prevent sperm from entering the uterus. Distractors. Prolactin, also known as luteotropic hormone or luteotropin. It is a protein best known for its role in enabling mammals, usually females, to produce milk. Follicle stimulating hormone stimulates the growth of ovarian follicles in the ovary before the release of an egg from one follicle at ovulation. Luteinizing hormone is crucial in regulating the function of the testes in men and ovaries in women. Third question. All of the following are saturated fatty acids except options A. Lauric acid, B. Palmitic acid, C. Oleic acid, D. Stearic acid. The right answer is option C. Oleic acid. Rationale. The saturated fatty acid are stearic acid, palmitic acid, myristic acid, lauric acid, capric acid, caprylic acid and caproic acid. Oleic acid is monounsaturated fatty acid. Fourth question. All are essential amino acids except options A. Leucine, B. Lysine, C. Phenylalanine, D. Tyrosine. The right answer is option D. Tyrosine. Rationale. The 9 essential amino acids are histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan and valine. Tyrosine is an amino acid that is naturally produced in the body from another amino acid called phenylalanine. Fifth question. The bodybuilding foods are all except options A. Fruits, B. Milk, C. Pulses and D. Poultry. The right answer is option A. Fruits. Rationale. Food to eat for bodybuilding are meat, poultry, fish, dairy, grains, vegetables, seeds and nuts, beans and legumes and oils. Fruits are not included for bodybuilding as it is used for slimming. Sixth question. Epidemiological triad is options A. Agent host environment, B. Agent vector host, C. Vector carrier environment, D. agent, treatment, environment. The right answer is option A, agent, host, environment. Rationale. A traditional model of infectious disease causation known as the epidemiological triad. The triad consists of an external agent, a host, and an environment in which host and agent are brought together, causing the disease to occur in the host. Seventh question. Riboflavin deficiency causes. Options: A. Beriberi, B. Pellagra, C. Chelosis, D. Sprue. The right answer is option C, chelosis. Rationale. Riboflavin deficiency results in stomatitis, including painful red tongue with sore throat, chelosis, angular stomatitis, and there can be oily, scaly skin rashes on the scrotum, vulva, philendrum of the lip, or the nasolabial folds. The eyes can become itchy, watery, bloodshot, and sensitive to light. Distractors. Pellagra is a disease caused by a lack of vitamin niacin, also known as vitamin B3. Symptoms include inflamed skin, diarrhea, dementia, and sores in the mouth. Beriberi. It's a disease caused by vitamin B1 deficiency, also known as thiamine deficiency. There are two types of beriberi, dry and wet. Dry beriberi symptoms include decreased muscle function, particularly in the lower legs, tingling or loss of feeling in the feet and hands, pain, mental confusion, difficulty in speaking, vomiting, involuntary eye movement, and paralysis. Wet beriberi symptoms include shortness of breath during physical activity, waking up, shortness of breath, rapid heart rate, swollen legs. Topical sprue is caused by inflammation of your intestines. Eighth question. State of social dysfunction is known as. Options: A. Disease, B. Sickness, C. Illness, D. None of the above. The right answer is option B. Sickness. Rationale. Sickness is a state of social dysfunction. Distractors. Disease. It is physiological or psychological dysfunction. Illness. It is a state when a person is not being well. Ninth question. Citrus fruits and dark green leafy vegetables are main sources of. Options: A. Vitamin C, B. Vitamin D, C. Vitamin B2, D. Vitamin B12. The right answer is option A. Vitamin C. Rationale. Dark green leafy vegetable and citrus fruits are rich in vitamin C. Distractors. Foods that provide vitamin D include fatty fish like tuna, mackerel, salmon, then beef liver, cheese, and egg yolks. Food rich in vitamin B2 are fish, meat, and poultry such as turkey, chicken, beef, kidneys and liver, eggs, dairy products, asparagus, artichokes, avocados. Vitamin B12 is naturally found in animal products including fish, meat, poultry, eggs, milk, and milk products. 10th question. The most universally accepted indicator of health status of the whole population is. Options: A. Crude death rate, B. Infant mortality rate, C. Maternal mortality rate, and D. Child mortality rate. The right answer is option B. Infant mortality rate. Rationale. Infant mortality rate is one of the most universally accepted indicators of health status, not only for the infants but also of the whole population, and of socio-economic conditions under which they live. Distractors. Crude death rate. The crude death rate is the number of deaths occurring among the population of a given geographical area during a given year per 1000 mid-year total population of the given geographical area during the same year. Maternal mortality rate is the number of registered maternal deaths due to birth or pregnancy related complications per 1 lakh registered live birth. Child mortality rate is typically defined as the number of deaths of children under 5 years of age in a given year per 1000 children in the same age group. Presently, it is known as under 5 mortality rate or U5MR. The term child mortality rate is not presently used. Thank you. Kindly like, comment, subscribe and press the bell icon for more updates.